Dear tutor, this is your home page. Once you log in, it will show here that if you have any kind of requests from any students. So you select here. We prefer that you fill the forms immediately after you finish and complete the assessment of any type of work-based assessments. So for example, this student, amazing, send you a request for MiniCEX. It's going to expire on 2nd of December 2025, so that will be 29 days from today. There is a message from the student to tell you about which MiniCEX that you've done with. So that was about a respiratory system examination. You have two choices. Either you complete it or you can decline it. Sometimes it can be sent by mistake. So wrong student sending to wrong tutor, so you can decline it. And if you click here on complete part, that's the same message that you've seen before. And then you click here on creating the assessment. So you can select where you did this kind of assessment. This is if regarding the presentation, patient's age and gender, not necessarily to be filled, but it's there, it's not mandatory. And then there are two components here. There is this first part of the assessment here, assessing only one domain out of the following three domains. You've got three domains here: history, examination, and counseling. So you can select one of them. So if you chose to do history taking skills, you are rated as you see appropriate, or if you do physical examination, or if you have a counseling evaluation. Here there's a description of how do you score. So 0 if it's not observed, unsatisfactory 1 to 3, and here a description how you give this kind of scoring. 7 to 9, which is superior if performs proper and systematic physical examination, illicit or relevant physical signs without hesitancy, for example. So let's say this is it was to assess physical examination and the student achieved 7 out of 9. Then you proceed with all mandatory domains. Now these domains are have to be filled to be able to save this assessment. The clinical judgment or reasoning skills, again from 1 to 9 scoring, and here are description how you rate that. The humanistic qualities or professionalism, organizational efficiency, and make sure that you fill the overall clinical competence. This is extremely important, and the system will not allow you to save it without filling that. Following that, you can provide feedback to the student using the adapt technique. So basically here, the description on how you do that, you're asking the student thought about his or her performance and discuss and coach the student on modifiable behaviors, ask the students to clarify points as necessary, and plan together the next steps for improvement. So basically you can write here, continue to do this, do more of this, do less of this, and the opportunity for follow-up. And then you fill your details here. Once you filled it once, it's going to be saved on the system, and then it can be generated automatically. Now you can save that as draft and you come back to it, and or you just save it and it goes to the page. So it tells you here that we haven't filled the mandatory parts, so we need to go back to it. So it says here, please select one of these options. And once we fill them, now it allows us to save the form. Once it's saved, it goes back to the student, and the student will be informed that the form has been filled. You can see here if you have any outstanding tickets or completed forms, it all appears there. Okay, and thank you very much.